My name is Christina Walden. I did my disease project for Intro to Microbiology lab on Herpes Simplex type 1. This is my PowerPoint presentation. Herpes simplex is a common viral infection. If you've ever had a cold sore or a fever blister around your mouth, you have contracted the herpes simplex virus. Most cold sores are caused by the virus type 1. There is herpes simplex virus type 1 and type 2. The specific one that my project is on is over type 1 and is also referred to as HSV1. The structure of the disease: after infection of skin or mucosa, herpes simplex virus enters the sensory nerve endings and is conveyed by retrograde and axial transport to the dorsal root ganglion, where the virus develops lifelong latency. Intermittent reactivation, which is spontaneous in humans, leads to anterograde transport of virus particles and proteins to the skin or mucosa, where the virus is shed and or causes the disease. The immune control, of virus infection and replication occurs at the level of skin or mucosa during initial or recurrent infection, and also within the dorsal root ganglion, where immune mechanisms control latency and reactivation. How it is transmitted. The transmission of herpes simplex virus infection is dependent upon intimate personal contact of a suspectical seronegative individual with someone who is excreting HSV. Virus must come in contact with mucosal surfaces or abraded skin for infection to be initiated. What causes this disease? Herpes simplex virus spread from person to person through close contact. You can get a herpes simplex virus from touching a herpes sore. Most people, however, get herpes simplex from an infected person who does not have sores, and doctors do call this asymptomatic viral shedding. Some common symptoms are blistering sores, either oral or genital, itching, pain during urination in case of genital herpes, fever, headache, tiredness, lack of appetite. But those are the most common symptoms. However, there are cases where individuals do not have symptoms at all, but they can still be affected. How to determine what the disease is. During an outbreak, a dermatologist often can diagnose herpes simplex by looking at the sores. To confirm that a patient has herpes simplex, a dermatologist may take a swab from a sore and send this swab to a laboratory. When sores are not present, other medical tests, such as blood tests, can find the herpes simplex virus. How to treat the virus. Treatment involves medications to relieve symptoms and manage the condition. Some of the medications used to treat herpes simplex are valacyclovir and acyclovir. Those are just to name a few. I do have some more alternatives that are present as well. To prevent this disease, you should avoid physical contact with affected people. You should avoid kissing and oral sex with those who are affected and who are showing symptoms or signs. Applying medication with swabs instead of your hands, and washing hands thoroughly after contact. And that is the end of my presentation. Thank you.